All right, guys, so we are going over Facet Syndrome today. What we are going to do is first we're just going to describe it, what it is, and what it feels like, what a lot of people complain of with this specific issue. And then we're going to get into what you can do later on in this video to help with this issue, okay? So to begin, what we're going to do is we're going to take this little model here and you're going to zoom in. I'm going to take the low back area because a lot of times Facet Syndrome occurs in the low back, because the low back has what we call a lordotic curve. So basically he's into a little bit of extension here, okay? So if we zoom in on the vertebra here, you have one above and one below, right? And the way that these two connect is through what we call the facet joint here, okay? The purpose of this facet joint is to prevent too much extension in the low back. So if I take this model here, because he actually likes to extend, and if you zoom in on one of those facet joints for me, and if I go into extension, you'll see that they start to compress on each other. The purpose of them is to prevent too much extension, but a lot of times if we're doing that too much over time, you can cause irritation in that specific area. So there is a couple of things that can occur. One, over time, if you cause constant compression in that specific area, you can get bony changes. Your body needs to adapt to that much compression. A lot of times you get bony growth in that specific area. These things occur with things such as osteoporosis, rheumatoid arthritis, things of that sort. Sometimes it can just be a nerve irritation in that area too. There's a specific nerve in between those joints, and if you're compressing on that nerve, it can cause sharp and shooting pain. So a lot of times what you'll see with people with this specific issue is you get that sharp pain, maybe very local in the low back if you go into extension, a little bit of extension and rotation. So I'm seated right here and I can do it and I can see if this recreates my pain. I'm really compressing on that joint there and it could be recreating it. Over time you can get muscle spasms in that area, so you can feel it around the entire backside. Most of the time it is just located on one side. Some people complain of referral pain as well. Sometimes it can come around to the front side here. It can come into the hip, into the glute a little bit. They describe it as sharp and achy, sharp and shooting, things of that sort, okay? So what do we do with this? Does this mean that I need surgery? Does this mean this is something I have to deal with for the rest of my life? Not necessarily, okay? So what I want you to do is I'm going to show you some things that you can try at home, but I want you to take a baseline level of what that pain feels like right now. If I go into extension and rotation, it causes that pain. Okay, let's try something out and let's go back to this and see how it feels. If you guys have something specific at home that you're like, yeah, every time I do this specific movement, it causes my pain, do that right now. Take a baseline of it and let's try some things, okay? So we're going to move down to the floor and we're going to do a couple of things here. So first one I want to do is what most people would know as child's pose, okay? So if I'm saying that extension is causing this pain, let's go into a little bit of flexion and see if it helps. So I'm going to just sit my butt back onto my heels like this, and I'm going to come down onto my forearms, rest my head into my hands, and just breathe into my belly and into my pockets here. This takes some of the compression off of that joint that we're discussing here. You're not going into extension. It's kind of opening up and creating space in that joint and allowing for it to calm down a little bit, okay? So we're just gonna hold and breathe here for 30 seconds to a minute. I want you guys, if you're gonna try it at home, pause the video, okay? Try this out, hold for a minute, breathe, and then retest. Get up for me. Retest either the movement that you chose for yourself or this extension and rotation. We're not looking for perfect, we're looking for progress. If it decreases your pain about 30%, then maybe you need to do that specific movement a little bit more. Dose it out more throughout the day and see if it helps reduce some of your symptoms. Another thing that you can try if that doesn't help is some exercises, some belly wall exercises. So the way that I like to explain this is if I take the bicep and tricep, if one is working, the other one is not working so much, okay? So same thing with the core and the low back muscles. If we're in this much extension and our low back muscles are turned on and putting us into this position, how about we try just turning on the opposite muscle and see if that helps as well, okay? So I'm gonna give you two exercises you can try at home. The first one is gonna be a crawl, okay? So we're gonna be in this position here, tabletop position. And what I'm gonna have you do is just push through your toes a little bit and bring the knees slightly up like so. Okay, from here, a lot of people will maybe kind of extendy. I want you to push hard through your hands. Bring your entire mid backside up towards the ceiling. So I become kind of like a beast-looking crawl almost, okay? So from here, I feel already my quads, but also my belly wall turn on. And I'm gonna try to keep this position, and I'm gonna go for a crawl like this, forward and backward. As you go through this, you might start to sink a little bit. Continue to push hard through your hands and crawl, crawl, crawl until you really just can't do it anymore. Your belly and your quads are really turned on. And then again, retest your movements that cause pain and see if it helped you at all, okay? I'm gonna give you guys one more thing to try at home if none of those worked for you. We're gonna go down into this position. And from here, I'm gonna say look through the tunnel. The tunnel means the space in between your knees, okay? So from here, what I'll do is prop up like this, and I'm looking between my knees, okay? Again, what I'm gonna do from here is push through my hands and my forearms, mid back up like so, okay? Squeeze my butt cheeks. I'm shaking already and my belly wall is turned on, I can feel it. From here, I'm gonna try to, without actually moving, bringing my elbows and knees close together. And I'm gonna hold and shake and breathe until I can't do it anymore. And then I'm gonna relax and I'm gonna retest those movements again, okay? So guys, please take advantage of watching this video, the pause button, try those things, retest your movements and see if they work for you. All right guys, so if this worked for you, what does that mean? That means that there is a chance for you and you just need a little bit of guidance in getting there. If you want this to go away for long term, then you need to take one of three options that we have for you. One option is we have a free gift. Somewhere on the video it might pop up. It will be in the description below. It's a link that you can click on. It's the next step, okay? How do I use these things if they worked for me? This free gift will help you with that, okay? Secondly, we have online options as well. We have online guides that you can pay for and you can follow, and there's links and videos and things of what to do and where to go from here. The last and probably the best step is to just reach out to us. You can come and see us in office or you can do virtual appointments at this time as well. But this is something that we can help you with. You just have to reach out to us and allow us to help guide you.